Kent Imaging is advancing tissue assessment with SnapshotNIR, a near-infrared spectroscopy imaging device that non-invasively measures tissue oxygenation. SnapshotNIR reports an approximate value of oxygen saturation, or STO2, as well as relative oxyhemoglobin and relative deoxyhemoglobin in superficial tissue. Oxygen is critical to life. As a terminal electron acceptor in the electron transport chain, oxygen facilitates efficient aerobic cellular respiration. Therefore, the delivery and utilization of oxygen at the cellular level is the primal determinant of the viability of cells and the tissue structures they support. The capillary beds between the arterial supply and the venous return contain approximately 5% of our total blood volume. It is in these capillaries where gas, nutrients, and waste exchange occur between the cells and the bloodstream. Oxygen is transported from the oxygen-rich environment of our lungs to the periphery by red blood cells. These red blood cells contain millions of hemoglobin molecules that reversibly bind to the oxygen that diffuses into them. The optical properties of hemoglobin change when hemoglobin binds to the oxygen. Therefore, we can use light to determine whether oxygen is bound or unbound from the hemoglobin. It is the surrounding gas pressure that drives the binding and unbinding of oxygen to hemoglobin. In high-pressure oxygen environments, such as an artery, most of the hemoglobin molecules are bound to oxygen. The hemoglobin arterial oxygen saturation, or SaO2, is approximately 97%. In the lower oxygen environments of the venous system, after the red blood cells have delivered their oxygen to the periphery, the hemoglobin venous oxygen saturation, or SvO2, is approximately 75%. During the journey between the arterial bed and the venous return, oxygen has desaturated or left hemoglobin, and the cells have extracted approximately 20% of the oxygen supplied by the hemoglobin. Today, commercially available technologies provide indirect or surrogate measures for tissue viability. Blood flow measuring techniques, such as laser Doppler, provide a measure of perfusion, but they are largely indicative of the arterial flow. Pulse oximetry provides a hemoglobin oxygen saturation, or SpO2, that is strongly correlated with the SaO2, or the hemoglobin arterial oxygen saturation. Both of these imaging technologies focus on the arterial supply. Angiographic methods, such as ICG fluorescence imaging, were developed to determine the patency of the conduit or larger vessels. While arterial oxygen, arterial flow, and large vessel patency are both important and necessary for sustaining cellular viability, they are not sufficient conditions for ensuring it. The problem is, these technologies provide only inferential information, which are indirect indicators that the cells and tissues are receiving an adequate supply of oxygen and nutrients for survival. With Kent's SnapshotNIR, a direct measure of tissue oxygen saturation and thus tissue viability is provided. Near-infrared spectroscopy imaging takes us one step closer to measuring cellular respiration. With this technology, we can measure hemoglobin oxygenation at the tissue-cellular interface. We call this measurement STO2. Near-infrared spectroscopy imaging with SnapshotNIR provides a non-invasive measure of the content of oxygen bound to hemoglobin in the blood, just below the surface of the tissue being imaged. Unlike other technologies, near-infrared spectroscopy is not restricted to looking at either arterial supply or venous return. Instead, near-infrared spectroscopy provides a comprehensive measure of the hemoglobin oxygen saturation of the entire vascular bed, including the nutritive vascular bed. In the case presented here, a 48-year-old non-smoking female diagnosed with left ductal carcinoma in situ underwent a bilateral skin-sparing mastectomy with a prepectoral direct-to-implant approach. Both SPY ICG fluorescent imaging and SnapshotNIR imaging were performed post-mastectomy. SnapshotNIR images showed the flaps to be well oxygenated and viable, whereas the SPY images showed an area of concern outlined in the clinical images as the area between the surgical marker and the incision line. Mastectomy flap size was preserved based on the oxygenation images obtained with SnapshotNIR. As a result, the surgeon chose to proceed immediately with the planned direct-to-implant procedure instead of switching to expanders. The mastectomy flap survived post-operatively and completed healing without complication. SnapshotNIR plays a critical role in guiding real-time decision-making. In this specific case, having the timely information that the flaps were well oxygenated and viable was a key factor in the decision to proceed with a direct-to-implant reconstruction. By measuring tissue hemoglobin oxygen saturation, near-infrared spectroscopy imaging with SnapshotNIR provides information on both the oxygen delivery and oxygen extraction at the cellular level. With this technology, a physician can determine areas where oxygen delivery is not meeting local metabolic demand. Detection and delineation of these areas of critical hypoxia provide a better assessment of tissue viability and translate into enhanced clinical decision-making. For more information on SnapshotNIR, please contact Kent Imaging or visit our website at www.kentimaging.com.